All right. Thank you for staying with us. Now we will be, Mr. Ritche Caburnay will be starting his presentation, Artists in Polysomnography, Artists in Subspecialty. Again, thank you for joining us and staying with us. Please don't forget to stay towards the end of our show today for a chance to win our 1,500 Philippine peso to our lucky winner. So take it away, Sir Richie, please.
Yeah, okay. Thank you so much, Michael. Again, thank you. Good morning, good afternoon, good evening, everyone, to all of our fellow respiratories here and abroad. And I'm going to thank ang Artimo YouTube channel for giving me this opportunity to discuss to everyone about respiratory therapist is in polysomnography, RTs in subspecialty. Okay? So let's just go first. What does polysomnography means? And for those, I think that in abroad, specifically in the Middle East, and also in United States and also New Zealand and in Australia, that there are already respiratory therapists that are also practicing as a sleep technologist or practicing polysomnography. But for the others who have not or haven't had any idea yet of what polysomnography is, I'll just give you a brief definition of that one. So, polysomnography is also termed as a sleep technology, which is a separate and distinct multidisciplinary allied healthcare occupation. So it's not just only a respiratory therapist who can practice as a sleep technologist, but also nurses or any allied healthcare professional or even non-allied healthcare professional can also work and practice as a sleep technology. Okay? So overnight polysomnography, of course, is a standard tour in sleep medicine. And what it does, it evaluates sleep-related physiology, sleep architecture, and sleep integrity. And of course, specifically, it's a complex evaluation used as a quantitative measurement of multiple physiological parameters during sleep, combined with expert observational reporting. So if I'm going to use it in a Tagalog term, literal na tayo nagbabantay ng pasyenteng natutulog. So it sounds creepy, but it most likely that would be the base of it. You're literally monitoring or looking at the patient while they're sleeping, observing a lot of things and observing probably around actions or gestures or whatever's happening with the patient while they are actually sleeping. Okay. Now, as sleep technologists or technicians and trainees, these are technical groups specifically trained to perform polysomnography and other technical evaluations used for diagnosis and treatment of sleep arousal disorders. Because supposedly, there is, for us, there's actually a difference between a sleep technologist and sleep technicians. They say that sleep technicians are the one in charge of putting all of the electrodes and preparing the patient. The sleep technologists also do that one. Aside from that, the sleep technologists also do the scoring of the sleep studies. They're also dealing with providing the intervention or treatment of CPAP to our patients with obstructive sleep apnea. And actually, that's the difference between the two. But nevertheless, the practice of sleep technology is very wide. That's why, regardless if it's a sleep technologist or a sleep technician, you need to be aware of what the profession is. Also, they are healthcare professionals who work as a part of the team under supervision of a licensed physician, specifically a sleep medicine specialist or a sleep doctor, to assist in the education, evaluation, treatment, and follow up of sleep disorders for all ages or all, of all ages. Remember that when you're performing polysomnography, you're not just only dealing with adult patients, you are also dealing with pediatric patients. So there is a training for both adult and pediatric polysomnography, and you will experience that one when you have encountered them in the sleep labs. Okay. Now, of course, sleep technologists follow accepted standards of care, including the American Academy of Sleep Medicine practice parameters, which are the foundation for clinical and technical decision making and for provision of patient sensitive care. Because my license is from the United States, of course, we are going to follow the accepted standards of care from the AASM, or American Association of Sleep, or American Academy of Sleep Medicine. However, of course, if you are a registered polysomnographic technology that is based here in the Philippines, not just only you're following the AASM guideline, but also you're going to follow whatever the BSSM guideline is, or the Philippine Society for Sleep Medicine guidelines in terms of the standard of care in polysomnography. At the same time, the profession employs a unique set of diagnostic tools in the interest of establishing diagnosis and developing the future of therapeutic intervention, which require expertise in the specialty of sleep medicine. You know the reason why there are respiratory therapists that are practicing sleep technologies. It's because of the pulmonary aspect of it, which is the one that we're dealing with the breathing, or the one that we deals with obstructive sleep apnea, or patients with apneas, hypopneas. And one of our intervention or treatments is actually administering or initiating the use of CPAP, or the continuous positive airway pressure, in dealing and treating with apneas and hypopneas and also snoring. But remember that sleep technology doesn't only involve respiratory therapy. It also involves, again, other allied healthcare professionals, nurses, physical therapists, occupational therapists, radiologic technologists. And there are a lot, or there are a subcategories of allied health professionals that are entitled to take the sleep technology licensure examination, which I will discuss later on. Now, as a sleep technologist, what is the scope of practice? What do you usually do in a sleep lab? For everybody, or you to be able to find out what are the scope of profession is, I will discuss this one in terms of categories. Let's go first with instrumentation. Now, the practice of polysomnography requires thorough familiarity with proficiency in the use of specialized instruments and observations used to record a variety of parameters during sleep and wakefulness. So these instruments include putting the EEGs, or the electrical electrodes in the head, which monitors brain functions, okay, or electrical brain functions, or the stages of sleep. Electrical potentials from the eyes, or the EOGs, which records blinking, blinking during wakefulness, and blinking during REM sleep. The electrical potentials from skeletal muscles, or the EMGs, for nasal and oral airflow, which also measures or monitors, the depth of breathing and the rate of breathing. And also there are chin muscles that is responsible for bruxism, or tooth grinding. And also we usually measure end-tidal or transcutaneous PCO2, or the amount of carbon dioxide in the way that we breathe. And also we monitor esophageal pressure or respiratory efforts from a variety of methods, including inductance plethysmography, piezoelectric belts, and usually they are being attached to your diaphragm and accessory muscles in order to monitor, okay, breathing activities or presence of apneas and hypopneas. We also measure pulse oximetry for oxygen saturation. We also monitor ECG or electrocardiogram uh, for arrhythmias, or normal heart rates, or normal heart rate palpitation, or other arrhythmias, esophageal pH, wrist actigraphy, audio visual monitoring of sleep awake and sleep movements, vocalization, respiratory sounds, and body positions. Remember, because you are not technically in the patient's room, you're actually monitoring your patients on the other side of the room, which has an audio visual monitoring, which you can visually and uh, hear the patients probably sleep talk, or you can hear them snore, or you can see their actions or mannerisms while they are asleep. Okay? And also the body position, if they're turning from supine to the side to prone positions. So you're actually monitoring them. Also, there is a patient self-report measures prior to and following study procedures and patient communications of critical events occurring during study procedures, including but limited to hypnagogic, how do you call this? Just a moment. Hypnagogic.
Reshare again. Sorry, I think we had a technical difficulty from my end. I do apologize. We will be right back with Mr. Ritchie here. I do apologize for the technical difficulty from my end. You know, it's not only the Philippines
Okay,
having a connection issue, but as well
internet
as to my
connection.
end as well.
Okay, no problem.
Okay, if you can reshare again po with your presentation.
Okay, hold on. Although I was thinking, was it on my end?
Yeah, no, it was on my end where I live. The wind here is too strong that we sometimes
Oh,
do have
okay.
these issues. So for our audience, we're
Mm-hmm.
back. I do
Okay.
apologize for that. Um, what do you call it? Technical glitch. It was caused from my end, and we will try to get back to you with our presentation here from Mr. Ritche Caburnay here. Um, okay. Thing, logo back, window share back, commercial. Okay. Whenever you're ready po. I think we stop at, yeah, like the previous slide po.
Yeah.
Okay. Whenever you're ready
Okay.
po, go ahead.
Okay. Thank you
Yep.
so much again, Michael. And again for our listeners, we do apologize for that technical difficulties, but hopefully that we're going to able to discuss again what we've previously discussed a while back, going back to whatever I discussed last time. So
Mhm.
again, as a sleep technologist, our
Sir Richie,
role in
sorry.
terms.
Your camera po.
Yep. Oh, hold on. I think I have.
Okay, just try
Can you
to
see it?
on and off po. I can't see it.
Okay. Uh, I can see my end.
Okay, yeah, keep going po. Maybe it'll. There you go. It's back.
Okay. All right.
Okay.
All right. So going back. So again, in terms of instrumentation or what you usually do to or what we're doing to our patients supposedly is, putting the different parameters for you to be able to look at the patient sleep study itself. Okay. So we're putting the electrodes for the EEGs, which monitors the sleep waves of your patients. but we're using the international 1020 system of electrode placement supposedly. And of course, we're also observing or putting EOGs or electro-oculograms, and it monitors uh, eye activities or eye activities, specifically the eye blinks during non-REM and eye blinks during wake and blinking during REM sleep. Of course, the tonic and the basic REMs. Tonic and the basic REMs. Also, we're also monitoring EMGs or electromyogram or the skeletal muscles, specifically to monitor the nasal and oral airflow. At the same time, also, we're putting chin EMGs to monitor bruxism or tooth grinding, so to speak. We're also measuring end-tidal or transcutaneous CO2 while the patient is breathing. Of course, we're monitoring esophageal pressure for the diaphragm accessory muscles, pulse oximetry for oxygen saturation in the event that while the patient is snoring or the patient had encountered apneas and hypopneas, there could be an associated a decrease in oxygen desaturation. Also, we're monitoring the electrocardiogram or the heart activity, specifically the arrhythmias, and also for the normal ECG wave, and also esophageal pH, wrist actigraphy, and also audiovisual monitoring. Because remember, you're not just only monitoring the patient's breathing patterns, the patient's snoring, you also wanted to look at the patient's activities or mannerisms or behaviors while they're sleeping. So that's the reason why you are putting an audiovisual monitoring, CCTV cameras and microphones that are attached to the pharyngeal areas to monitor sound activities. Of course, you need to monitor as well sleep movements, wake or sleep movements, vocalization, respiratory sounds, and of course, body positions. Of course, you need to report measures, what is happening to your patients prior to and following study procedures. And of course, you need to communicate with your patients for some critical events occurring during study procedures, including but not limited to hypnagogic or hypnopompic hallucinations, sleep paralysis, and nocturnal panic attacks. Because sometimes, aside from that, you're also um, going to monitor or you're to observe if the patient is having night terrors, nightmares, or is the patient is dreaming, or does the patient sleep talks, does the patient sleep walks, is the patient is encountering head bangings, or is the patient having bedwettings? Now, in terms of performance of polysomnography, again, aside from putting the electrodes in the whole body of the patient for monitoring the calibrations or for monitoring the sleep study, you're also going to perform or initiate the completion of overnight and daytime polysomnography. What you're doing at daytime or at nighttime or observing the sleep study during nighttime is going to be different during the daytime polysomnography. Because in daytime polysomnography, well, it would depend if the patient is a night shift worker. You can perform a daytime polysomnography to them because you can't perform an overnight polysomnography to those night shifters because they usually are awake at night and asleep during the morning. Okay, so that's why you're going to do as well the over or the daytime polysomnography. Aside from that, you are also going to perform uh, MSLT or multi sleep latency testing and also maintenance of wakefulness testing. MSLT or multiple sleep latency testing allows you to observe your patient how fast are they going to be asleep, how fast are going to asleep, okay, and that occurs during the daytime because you're going to observe excessive daytime sleepfulness when you're performing MSLT. And also the maintenance of wakefulness testing allows you to monitor the patient how how long are they going to stay awake. Okay. No, aside from that, you're also, of course, completing the required recording of the patient signal calibration to ensure that all of the electrodes that you're putting in the patient's body are actually working fine. So that once that you have performed biocalibrations or signal calibrations, you're already running for a continuous polysomnographic monitoring. Of course, you're going to respond to or any correction of equipment malfunction. Say, for example, if there's one electrode that has been disassembled or disattached from the patient's body, then you can see that one in the patient monitoring, and then you will just go into the patient room and try to inform the patient that going to attach again those electrodes. So technically, there are a lot of this one, and then of course performing online monitoring and analysis of the polysomnogram, including sleep staging. You are going to score the stages of sleep from stage wake to stage N1, N2, N3, stage REM. Okay, noticing events like, for example, apneas, hypopneas, or EEG arousals, or brief awakenings, what they call it, variations in respiratory effort and airflow, changes in cardiac rate and rhythm, periodic limb movements, stereotypical body movements, vocalizations, and other physiologic and behavioral events. You need to, of course, to maintain a log of study of events in intervention, meaning you need to document whatever that is happening, technically what's happening in the patient while they're sleeping. If they're changing, or if you observe night terrors, or if you observe that the patient is sleep talking, then you're going to document that one in the sleep study itself. Um, if you have observed, you need also to recognize, document, and characterize clinical and electrographic seizures. You also need to perform cognitive testing during clinical seizures, performing evaluations of excessive daytime sleepiness and ability to maintain wakefulness. You need also to recognize and responding to clinical events and occurring during polysomnographic monitoring of cardiac arrhythmias. So probably the patient, if the patient has a history of hypertension, or if the patient has arrhythmias while they are on this specific position, or is it because they have a cardiac pacemaker that is attached to their body. You can also observe if the patient is desaturating, if the patient is encountering chest pain or breathing distress, or other abnormal EEG activities with or without significant motor activities. So, or if, for example, the patients are potentially violent and injurious behaviors such as sleepwalking and REM sleep behavior disorders, and other potential medical emergencies. So supposedly, again, because there is an audio visual monitoring, you can actually see what is really happening in the patient. Again, if the patient is sleepwalking, sleep talking, if the patient have periodically movements, or if the patient has uh, behavior disorders, or if the patient has, for example, a ventricular tachycardia, or ventricular fibrillation or atrial fibrillation, that something that is emergency that you need to attend to the patient. And also you need, while you're doing that one, of course it is a must for each and every sleep technologist to perform or assist in basic cardiopulmonary resuscitation if it's required. Say, for example, if you have seen that there is a ventricular tachycardia that is happening to the patient and is considered emergency, then you need to perform basic CPR. And also, while you're doing that one, you need to ensure the simultaneous alerting of on-call responders. If the sleep lab is inside a hospital, you can call a code and informing the code team that there is an emergency happening inside the patient's room. And of course, if it's a home sleep testing or an outside sleep laboratory, then you can call emergency services personnel if it's deemed necessary. Okay? Now, aside from that, of course, the practice of sleep technology, you are able to apply titration of non invasive bi-level or CPAP devices, or even supplemental low flow oxygen in spontaneous breathing patients during sleep studies. Say, for example, if the patient is an O2 required patient, then you need to install or you need to uh, put nasal cannula while the patient is sleeping. For example, if the patient is a COPD patient that requires a low oxygen O2 requirement or low oxygen requirement, then you need to put a nasal cannula while the patient is sleeping and observe for uh, desaturations or if they have apneas and hypotenuse or breathing rhythm events. You need also to apply and monitor a pulse oximetry during sleep studies. Again, this is in terms of if the patient is desaturating, then there should be an associated respiratory event that will happen or that will occur while the patient is desaturating. And also monitoring and application of capnometry or the end-tidal or transcutaneous carbon dioxide monitoring to monitor also the carbon dioxide levels in the patient while they are breathing. Also, performing testing techniques in diagnosis, monitoring, and research for sleep of and waking disorders, including but not limited to again overnight attended polysomnography, MSLT, MWT. So it is a must that you also need to perform MSLTs and MWTs aside from overnight polysomnography. And of course, you need to develop future therapeutic interventions under the direction of a licensed physician. Of course, when you say therapeutic interventions, which means the application of positive airway pressure titration and oxygen titration. Now, in terms of professional education, of course, you need to at least be aware or we have a knowledge of the pathophysiology and behavior changes associated with sleep and arousal disorders, understanding of the sleep-induced changes in the physiology of various body systems, including but not limited to the neurological or musculoskeletal disorders or cardiac, respiratory, and thermoregulatory systems. That's the reason why majority of the sleep technologists are into the allied health profession, specifically those with at least a background in in the study of the neurological, musculoskeletal, cardiac, respiratory, and thermoregulatory systems. You also have a working knowledge in the effects of medication on sleep architecture and physiology. Say, for example, if the patient has insomnia and the doctors are requiring to put or to have the patient take um, sleep medications or sleeping pills? Would it affect the quality of sleep of the patient, or would there be fragmented sleep? Or what are other medications that would you think that would have an effect on the sleep architecture and the physiology of your patients? It's also you need to have a competency in the field of sleep medicine and performance of polysomnography, meaning a completion of an accredited training program is currently recommended but will be required when adequate number of programs exist. A sleep technologist should have a certificate by the Board of Polysomnographic Technology or BRPT. BRPT or the Board of Registered Polysomnographic Technologists is a licensing body
All right, to our audience, we're currently reconnecting. Give us a few minutes and we'll be right back. If you guys have any questions, please type it in on the chat box and we will be answering your questions um, um, towards the end or right now. So um, while we're reconnecting with our speaker here, let me take this opportunity to thank each and every one of our audience today who are joining us live, and of course to our audience that we will are going to stream this via our YouTube channel on a later date or later time. So we thank you for your support, and thank you for your support to our channel, to our advocacy here on Ang Artimo. Um, yeah. So if you guys have any questions, please type it in. We do apologize for our technical glitches here, but we will be back live as soon as we're able to. Now, if you have any question, please let us know. And as well, just would like to remind our audience that you can follow us on Ang Artimo po, ANGRTMOPO, on our Facebook page for dedicated for Ang Artimo channel. You can join us on our private Facebook group, Filipino RT, PILIPINO RT. That's our Facebook Filipino Association of Respiratory Therapists International Facebook page. And Ang Artimo YouTube channel. So you can join us on Ang Artimo po at YouTube as well. And it seems like we're now back with Mr. Ritche Caburnay here with his presentation. Thank you, sir. Please take it away.
Okay, thank you so much. Again, my apologies for some technical difficulties due to internet connection. I'm just going to give you a run through of the other slides so that we can try to finish it off at the latter time. So, aside from what I've discussed previously or earlier, again, going back, you need it's very important for a sleep technologist for a completion and of accredited training program that is of course recommended and also required of the number of adequate number of program exists, meaning that aside from obtaining the certification from the board of registered polysomnographic technologists, you should have as well a number of hours of clinical experience in the sleep laboratory for you to be able to take the examination or the licensure examination for as sleep technologists. Aside from that, one of the requirements as well is to obtain and to have a maintenance competence in the performance of basic cardiopulmonary resuscitation. So, meaning you should have a certification for a basic life support in order for you to take the licensure examination as a sleep technologist. Now, aside from the two scope of practice that I discussed previously, you also need to interact also with your patients in terms of the CPAP titration, and you're also going to assure the patient throughout the duration of the sleep study that you are ensuring him comfort and safety, and also to promote the patient understanding and compliance with all the applications, okay, or the procedures with regards to the sensors or the electrodes during the sleep study, and also the CPAP and oxygen titration, because if you're not communicating or if the patient isn't understanding what they're doing, why they are performing this sleep study, then there will be a possibility that there will be some connection or miscommunication in terms of the performance of the sleep study. So you need to talk to them and have them be aware of what the purpose of the sleep study is. Aside from that, you need to review the patient's clinical history to thoroughly understand the patient's sleep related problems, because uh, you're not just only there to do the sleep study, uh, uh, put all the electrodes and everything. You need to understand the reason why they are doing or they're performing a sleep study. Because once that you read all the patient's information, the medical history of the patient, specifically sleep related problems, that you will understand why or what's the approach or the proper intervention in management. Aside from that, you need also to record the patient's vital signs such as weight, height, neck circumference, and blood pressure, because these are the essential factors that will affect in the sleep study of the patient. Also, have the patient develop sleeping habits that promote good sleep hygiene, which means you need to inform them, at least give them a piece of advice or a recommendation or and suggestion on proper sleep hygiene. Okay, and of course, last one is communication. You need to communicate with your doctors, with your patients, and also preventing the Privacy Act, or in help in promoting the Privacy Act, meaning whatever information that the patient has given you, there should be no other people other than you or the doctor will be the one knowing whatever the situation or the condition of the patient. So we are very strict in implementing the privacy law or the Privacy Act in the United States. Okay. Additional task includes you as a sleep technologist can be a manager or administrator of a sleep lab. Okay, you also need to supervise your staff, your students, or other ancillary personnel. You also need to develop policies and procedures in terms of handling a sleep laboratory. You also need quality assessment in terms of um, data collection, report mechanism, trending, and procedural compliance. You need also to provide community meetings and departmental reviews, problem focused studies, and problem solving interventions, documents, and process oversight of the overall operations of the sleep lab. You also need to educate them, clinical and didactic teaching to your students, to all the trainees, uh, perform training and also raising public awareness and facilitating patient support groups related to sleep disorders. Because sometimes it is important not only to educate our trainees and students, but also you need to educate your patients in terms of sleep disorders and how will it affect their health and wellness. Okay. Um, of course, again, visually you're doing this one as a recording technologist, so you record the sleep study of the patient day or night. Okay, so if you're going to see there that there are a lot of electrodes being attached to the patient's body, including again the head or the EEGs for the electrical waveforms or the sleep waveforms, the eye electrodes, the nose, the thermistors or the cannulas, the abdominal belts, the respiratory belts, the chin EMGs, the snore mic, of course the legs, the oxygen saturation, so on and so forth. So at the same time, you don't only monitor the patient, but you also score. And when we say score, you score the sleep study according to the stages, like stage wake and one and two, and REM stage. You also score apneas and the presence of apneas and hypopneas. You also score periodic limb movements. You also monitor or score arrhythmias or normal sleep, a normal ECG pattern, okay, normal ECG waves. So you also need to score the desaturations and also score if the patient's body positions, if they are on supine, lateral, sideways, right side, left side, or the prone position. You also have to be familiar with the current products or the durable medical equipment or the positive airway pressure machines, CPAP machines, CPAP, BiPAP, AutoPAP, and also mask fittings for complete face mask or your nasal mask or nasal prongs that will fit your patient needs and also that will fit them and will be beneficial for them in terms of CPAP titration. We also perform home sleep testing, but the difference is that in home sleep testing, you're only monitoring the breathing of the patient, the abdominal belts, the position of the sleep, and also the oxygen saturation. That's only what you monitor for home sleep testing, and also for some researches. Okay. At the same time, this is the requirement supposedly, but I'm going to skip on that one. We're going to what are the scope of the examination that were being given to sleep technologists. Supposedly, uh, there should be an accreditation or the what we call the CAAHEP or the CAHEP. CAHEP stands for the Commission on Accreditation of Allied Health Program, and this is a governing body wherein which if a person graduated from any allied health professional course or program that is accredited, okay, by the BRPT, then you are eligible to take the examination. So that's CAAHEP, or the Commission on Accreditation of Allied Health Program, or the COART, or the Commission on Accreditation for Respiratory Care. Okay. Uh, STAR education is what we call STAR, meaning Sleep Technology Approved Resources. Because supposedly, when you're taking the certificate program, you need to have this STAR status, or it's more like uh, a crash course on sleep technology. Program, or is it going to be an online modular program? Okay. So, what do you need to learn, or what are the scope of examination if you wanted to be certified or you wanted to be a licensed polysomnographic technologist? Of course, the A-step module, okay, has a breakdown of the lectures or the modules for you to be able to learn and study when you are taking the monitoring, the basic EEGs, the recordings of artifacts, respiratory monitoring, polysomnographic protocols, the breathing during sleep, and many others. So if you have any questions for this one, I'll just going to send you a copy of this lecture so that you will be able to know what is the scope of for the licensure for sleep technologists. Okay, once um, once that you have tried to obtain those lectures, you need now to know as an RT saan ba tayo naka-align if we are going to we are actually on the pathway we call it on the pathway two. Okay? On the pathway two, we have candidates with a minimum of 546 hours of experience who have another healthcare credential. So, for example, if you are a graduate of respiratory therapy, and if you have a minimum number of 546 hours of a clinical experience in the sleep lab, plus you have a certificate in basic life support, then you are entitled to take the examination for the Board of Registered Polysomnographic Technology, or the PRTP. And that is if you are here in the Philippines. So you need to be on that RPSGP pathway 2, which is a healthcare credential status. Okay? Now, again, the RPSGT or the Clinical Pathway 2 for Healthcare Credential, ito yung requirements niya. You need to complete a minimum of 546 hours of clinical experience. You need to have a clinical experience within the 3-year period prior to the exam. You must have a current allied health credential listed on the list of accredited allied health credentials. Okay? You need to submit all of those to the BRPP so that you will be taking the examination. Okay. Now, who are those uh, people or allied health professionals that are candidates for the RPSGT examination? So first on the line is the nurses, or if you're a registered nurse, or in the United States, if you are a licensed practical nurse, of course, respiratory care, regardless if it's an RRT or a CRT, so the credentials must be granted by the NBRC or a foreign equivalent. State licenses do not fulfill this requirement. If you had a training or experience in electroneurodiagnostics, such as the registered EEG technician or the registered electrophysiologist, okay. If you have a physician's assistant certificate, if you have a PhD in a health related field, of course, if you are a doctor, medical doctor, doctor of osteopathy, chiropractic doctor, a paramedic, a physical therapist, an occupational therapist, a doctor of dental surgery, a radiologist, including a radiologic technologist or an X-ray technologist, a certified hyperbaric technologist, a certified nuclear medicine technologist, a cardiographic technician, a doctor of public health, a registered diagnostic cardiac sonographer, a registered cardiovascular invasive specialist, the doctor of audiology, a certified athletic trainer, a medical technologist, and or a doctor of podiatry. I was given the opportunity to be a part of a team here in the Philippines when I was training and N2 sleep diagnostics, wherein which my mentor was no other than one of the the pioneer in sleep tech polysomnographic technology, Mr. Glenn Roldan. And he used to be my mentor and trainer at N2 Sleep Diagnostics here in the Philippines, where I was being trained as a sleep technologist and a snoring technologist. So here I am at the sleep laboratory at that time of N2 Sleep in Chinese General Hospital, where I perform an overnight polysomnography to a patient. This is the actual bed for the patient, and this is, of course, the CCTV monitoring and the sleep study monitoring, complete with the biocalibrations or the electrodes for the patients. And these are some of the fellow sleep technologists that I used to work with. As majority of them are actually nurses, and some of them are my fellow respiratory therapists that are already working not only here in the Philippines but also overseas, specifically in the Middle East, in Dubai, United Arab Emirates, in New Zealand, and in Australia. Okay, so I hope that you were not being bored or you were not felt sleepy during my lectures. So again, thank you very much, and my apologies for some technical difficulties, and hopefully you were able to learn something from my perspective as a respiratory therapist who's also practicing as a sleep technologist. So again, thank you so much again, Michael.
Thank you so much, Sir Ritchie, for sharing this wonderful presentation regarding RP, the polysomnographist registered polysomnographist program or pathway that our fellow respiratory therapists can go to. If our
Technologist.
yeah, if our audience has
Yeah.
any questions, please let us know. Um, uh, Mr. Ritchie, I believe now is able to answer any of your questions. Um, oh, sorry. Let's.
Yeah.
You're still here, sir, correct? Oh, here.
Yes, yes, yes.
Okay, here we go.
Yes, Sir Kenneth. I'll provide the slides. You'll just try to message me, or if you can send your email address so that I can send you the slides for this one. It will be greatly appreciated.
Now, okay. Now I'm trying to put myself back on the tile here. Hold on. All right. So if you
Okay.
have any questions, concerns, please type it in on our chat box on our YouTube channel. Here you go. I'm back here. Um, we will answer your question. Hopefully, we have the answers for your question here. Oh, here, sir. We have a question from Miss Desiree Antonio. Do you have an idea po of the cost of RPSGT professional uh, education training and exam here in the Philippines? Thank you po in advance.
Oh, okay. Thank you. Actually, if you're going, well, here in the Philippines, it's Pearson View, who is the accredited testing center for the RPSGT. And if you're going to process a payment, supposedly from the BRPT, that is actually $450. So, rough estimation, that's around, it's a little bit pricey. Roughly, it's around, I think, 15. I'm not sure if it's 15 to 20,000 pesos, or 50, I
Mm-hmm.
think it's 15,000 pesos for an examination. Bear in mind that this RPSGT examination care of Pearson View is a computer assisted time constrained examination. It's a uh, it's a 200 and I think 200 to 250 item examination that is only constrained for 2 hours, and then the result will actually show right after the exam if you pass or fail.
Mm-hmm.
So if unfortunately you did not make it, if you failed the examination, then goodbye $450.
Yeah. So, Sir Richie, for those who might have missed your presentation earlier and just joining us now, so who gives out the RPSGT professional or credentialing license?
Okay, the BRPT, or which is Board of Registered Polysomnographic Technologists, is the license or the credentialing licensure body that is the one responsible for the licensure examination for the respiratory therapist
Which is based in
in United States,
in
in
the United
US.
States. Awesome. So, do
Yes.
so just a question for my end. The Philippines don't have an RPSGT license so far.
We don't have,
Mm-hmm.
because actually there was a plan from the Professional Regulations Commission Board
Mm-hmm.
of Respiratory Therapy to have a subspecialty licensure
Mm-hmm.
examination for sleep technologists. But right now, they're still in the process of doing the subspecialties. But I think it would be best first if we should focus for more first on the licensure for the RTs,
Mm-hmm.
because it will be a long while for us to have this subspecialty for
Right.
our end,
Uh-huh.
because we don't have a lot of RTs yet that are being licensed. So
Right.
I think it would be best if we could have more RTs first
Yes.
to get licensed before they go into the subspecialties.
Subspecialty.
So
That's good.
yeah, as a subspecialty, that's the reason why we're still recommending first. if they're going, if for example, if you already passed the board exam for RT, and
Mm-hmm.
if they wanted to take the exam as a sleep technologist,
Mm-hmm.
then there are some training centers here in the Philippines that is training that allows training for sleep technologists, and then they'll try to assist you in processing your license in the BRTT, because again, during my time when I took the examination for BRTT, um, I sent a wire transfer money through I think through Western Union for me to be able to send the money directly to the BRTT for me to be able to process the examination fee. Uh, the good thing about it is that during that time, some of my previous coworkers was able to do that from our previous company, and it's very difficult because since it's, in the Philippines we don't have one yet, so it's very hard for us to process the payment here in the Philippines. That's why it is taking us a long while for us to process our credentials to be submitted in BRPT because it's in the US. And
Mm-hmm.
for them to be able to receive our credentials, of course, to check if we are candidate, if we are how do you call it, qualified enough to take the
Mm-hmm.
examination.
Mm-hmm. That's good. I'm glad that the Filipino artists are able to sit for a licensure exam in the U.S. Given that the education is based in the Philippines. That's great, and then that's the challenge too
You know,
as well for the RT license.
well, that's a good thing about that's well, there's a pros and cons of it because supposedly, even though that there are some private companies that are providing or assisting fellow RTs who wanted to study sleep technology. The downside of it is it's more of the processing of the
Mm.
credentials because
Mm-hmm.
supposedly, if you remember my discussion previously, that
Mm-hmm.
you need to have at least 546 hours of clinical experience in a sleep lab for you
Mm.
to be able to, or aside from a graduate of an allied health profession and
Mm-hmm.
also a certification for the as a basic life support
Right.
provider. So if you can't submit if you submit it incompletely, then you're unable to be qualified for that one. So at least you have to complete all of the necessary requirements that has to be submitted so that you are eligible to take the examination.
Yeah. Yeah. Thank you. Thank you. Do if our audience has thank you, Miss Desiree Antonio, for your question. And thank you, Mr. Ritchie, for answering that question. If you guys have any more questions, please send it in and type it in on our Timo YouTube channel. Thank you so much. And with that, I think, and then this stream will be available for a later view from on our Timo YouTube channel. So if you have missed and just joining us now, it's available for a three part. First one is or two part at this time. So it'll be the Q&A for Mr. Ritchie Caburnay, and then the second part will be the presentation and the Q&A this portion. So if you're just joining us, you can visit our Artimo YouTube channel so you can stream our videos that are stream live currently. So thank you. Any more questions? Please type it in. But I think if there's none, we can proceed with your questions, Mr. Ritchie, so we can give out our humble what do you call it price for today's episode.
Right. Okay, all right. So here's my first question. Is it going to be five questions, right?
Yes. So the rule again for for our new viewers, you have to answer on Ang Artimo YouTube channel, and whoever gets the most correct answers will get the prize. So prepare your YouTube and your fingers to type it in. whoever give us the first correct answer will get the point, and whoever has the most point will be the winner for tonight's or today's episode. Go ahead, Mr.
Okay.
Ritchie.
Okay. So my first question is, what does AASM stands for? Again, what does the acronym or abbreviation AASM stands for?
All right, type it in on Ang Artimo YouTube comment section. AASM.
It's actually it's an organization. So just a clue. It's an organization in the United States. And supposedly we are following their guidelines in terms of the protocols
Yeah.
in sleep study or
All right, we
polysomnography.
have an answer, Sir Richie. Tell me if it's right. American Academy of Sleep Medicine.
Yep,
All
correct. That's
right,
correct.
thank you, Mr. Jason. You got 1 point. Thank you so much. Next question, please.
Okay. Second question. What is the licensing body for sleep technologists? Okay. What is the accredited or licensing body for sleep technologists? It could be an abbreviation or it could be the whole name itself.
Go, go, go. Type it in. Abbreviation or acronym is accepted or the whole thing?
Accepted.
Yep. All right.
Either or.
BRPT.
Yep.
All right.
And BRPT stands for the Board of Registered Polysomnographic Technologists.
All right. Thank you. So Gemly Malado got another point. Next question, please.
Okay, congratulations. Next question. What does CAAHEP stands for? Again, what does CAAHEP stands for?
Who's gonna get the next point? All right, sir. Can you repeat the question one more time, please?
Okay. What does CAAHEP stands for?
Commission on Accreditation of Allied Health Education Program.
Yep, that
All
is
right.
correct.
Thank you, Mr. Jason. You now got 2 points. Next question, sir, please.
Okay, thank you. What does COARC stands for?
Oh, that's we covered that on our last episode. What does COARC
Yes.
stands for?
Faster fingers.
All right, let's go. Let's go. Type it in. COARC. While we're waiting for answers, would like to shout out to our audience, especially Mr. Kenneth Revelo joining us from his work at Houston, Texas. Thank you, sir, for joining us and supporting our channel and our advocacy here on Ang Artimo. We do appreciate everything that you do and your support. We're still waiting for answer. Co-art, commission on.
Commission on.
Let's do it. So COARC is the accrediting body that oversees our respiratory care program. So we got no, 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 no. You're missing COARC. COARC.
Yeah, co-art.
You gotta change one word, Mr. Jason. All right.
There's already someone.
Yeah. He says a commission on accreditation for respiratory therapy.
Oh, it's
Yeah.
co-arc.
Co-art. Just change the therapy to something else. That's the clue.
Yep.
Mm-hmm. All right. Commission on accreditation for respiratory care. Thank you, Mr. Jason Ibay. That's correct, Mr. Ritchie, correct?
Yes, that's correct. Absolutely correct.
Thank you. And next, so now leading is Mr. Jason with 3 points and Gemly with 1 point. All right, next question, please.
Okay, last question.
Mm-hmm.
Which clinical eligibility pathway do respiratory therapists can be qualified for an RPSGT licensure exam? Again, which clinical eligibility pathway do respiratory therapists can be qualified for an RPSGT licensure exam? So there's RPSGT pathway 1, RPSGT pathway 2, RPSGT pathway 3. Which of those do you think is for us respiratory therapists?
All right, you got three options: RPSGT pathway 1, 2, or 3.
Actually, there's two more. Sorry, it's 4 and 5. So RPSGT
Oh,
pathway 1, RPSGT pathway 2, RPSGT pathway 3, RPSGT pathway 4, or RPSGT pathway 5.
all right, we got an answer. Pathway 2, is that correct?
Yes, that's correct.
All right, congratulations, Mr. Jason Ibay. You got 4 points. If you can just tell us where you from on the chat box, and please do message ang Artimo Facebook page, not the group, the Facebook page. Please send me in your information. I'll we will get back to you. And congratulations, 1,500 pesos. It will go a long
Yay!
ways.
Congratulations,
Thank you.
Jason.
All right, so Mr. Ritchie Caburnay, again, thank you for your time, for accepting our invitation, for sharing your knowledge and expertise, most especially with to our topic today with the field, in the field of polysomnography. For sure, a lot of our audience now know, how to get an RPSGT license, which pathway to take, and the processes of getting one. Thank you, sir. If you have anything for us for closing remarks, please do. You have the floor now.
Okay, thank you so much again, Michael, for this opportunity to be interviewed and discuss about RTs in polysomnography. Again, I do hope that whoever is interested in taking part in a subspecialty, especially in sleep technology or polysomnography, whether it's here in the Philippines or overseas, you can just talk to any sleep specialist or an RPSGP on ways on how you're able to communicate or how you able to take the exam. For here in the Philippines, there are some again accredited companies or private institutions that are offering trainings for sleep technology and be able to assist you to take the licensure examination for BRPT. Um, One of those is under teacher Sir Glenn Roldan, which is the Neuro Sleep Center of the Philippines. And you can actually get in touch with teacher Glenn or Glenn Roldan through his Facebook account and message him. Also, there's Sleep A to Z under Kem Balyaho, who's also a sleep educator. You can also get in touch with Kem Balyaho on his Facebook account. And if you're interested in taking part in the course of polysomnography, again, thank you so much to everyone. Thank you so much, Michael, for giving me this opportunity. And I hope
Mhm.
that we're looking forward to more artists who will be joining us in the discussion. Hopefully, we're able to get some, insights or point of
Mhm.
views or whatever it is in the field of respiratory therapy.
Thank you, Mr. Ritchie. We do appreciate you, and for sure, we will invite you again for our next episode. Thank you so much, and yeah, thank you so much. Happy Sunday, and enjoy the rest of your day, sir. Thank you so much.
Thank you. Thank you. Happy Easter, everyone.
Thank you. All right. All right. So here we go. Thank you. Yeah, that's our speaker, Mr. Professor Ritche Caburnay from Pampanga, Philippines, representing, or who's currently working at a hospital and at a college in the Philippines. Again, Mr. Jason Ibay, please do message ang RTMO Facebook page. Um, so we can get in touch and claim your prize. Thank you, congratulations. And again, once again, as always, Pine City Colleges, maraming salamat. Thank you for your support. We do hope to see, there's a lot of RT schools in the Philippines. I hope you guys could join us. Um, I hope that you guys are getting some insight and information from this channel, from this YouTube channel, and from our group. We do a lot of collaboration. We do share some, respiratory therapy related, what do you call this, education materials in our Filipino RT or Party Facebook page or group. If you can join us there too. Again, prayers and thoughts to everyone, all our respiratory therapist colleagues all around the globe. We do appreciate your service to the professions, to the profession, to your patients, and to one another. We thank you. We hope that we remain united, unified respiratory therapists. Be there for each other. We have to fight this pandemic all together as one group. Again, we would like to invite future speakers. If you can share your knowledge and expertise in related field of respiratory therapy, please do message us on Ang Artimo or at my Facebook page at Michael D. Peralta. I would love to connect with you for the love and to share our passion to our fellow respiratory therapists. Please do consider joining us for our next episode. Um, we hear your suggestions for next or for following episodes. We will consider that, and we are currently looking for resource speakers. So stay tuned for our next episode, ang RT next Sunday. Please stay tuned. With what topic and who will be joining us for next week episode. Now, let me remind you for our current RTLE, Respiratory Therapy Licensure Examination Top Notchers, Board Top Notchers. We are looking for you. We would love to feature you on our next episode here at Ang RTMO. We would love to know your tricks. We would want to hear tips from you so our future RPs could learn from you. So we are looking for you, especially with our schools from University de Zamboanga, Pine City Colleges, um, Emilio Aguinaldo Colleges, Far Eastern University, Nicanor Reyes Medical Foundation, University of Perpetual Help in Las Piñas, Manila, and Laguna. I know that you guys have some top notchers in there. From Lorma Colleges, I think you guys have a top notcher too. Any top notcher from different part of the Philippines, if you are a recent top notcher for our 2021 RTLE, we want you to be in our show. We would love to recognize you and we would love to learn from you. Um, that's gonna be ang RT mo episode 6 or 7. We'll see when we can get more participants. And the title will be How to Be You, Future RTRP. How to be you po. But anyway, thank you for joining us for tonight's episode or today's episode. Happy Easter to all our colleagues or to our brothers and sisters in the Christian religion. Happy Easter. Hope you guys enjoyed the day. And prayers to all of you. See you guys on our next episode of Ang Artimo. Once again, thank you, Professor Ritche Caburnay. And I am your host and your respiratory therapist, Michael D. Peralta, wishing you a good day, a good Easter, a good night, or good afternoon. Thank you so much for your support. Until on our next show, maraming salamat po. Stay strong, RT strong, and we are with you every single day and night. Maraming salamat. See you guys next week.